good evening, everyone. Thank you for joining us this evening. So we're here this evening just to go through kind of an outline on the veterinary nursing, veterinary care assistant courses that we have at the College of Animal Welfare. So hopefully it will give you a really good insight into the courses and the provision and how you can get onto the course, what it all entails. So there is a lot of information, but the reason that these sort of webinars often work quite well is because basically we try to outline it to you quite clearly on the different options that you have, the different routes that you can take, and just in terms of sort of advancement on that as well. So lots to cover. I will crack on. In terms of the format for it, then it will be predominantly sort of the PowerPoint that I'll be going through first. There is a Q&A box that you will see just within your kind of platform there. Any questions that you have that come up, you're welcome to put those in there and I will come to them all at the end. The hope is that the talk is so comprehensive that there won't be many questions to go through at the end, that we've answered most of them. If some are more kind of personal, it might be that we contact you and it's something that we can follow up later. However, again, at the end, I'll do my best just to whiz through the Q&A just to see if there's anything in there that we can cover, because if it's a question that's come from someone that's not been answered during the presentation, it probably is relevant to quite a few of you as well. In terms of any technical difficulties, then please contact the host. They will be able to help you as best as they can. So if you send them a private message, they will do their best to help you out. Okay, so I will get started on this evening's presentation. So first things first as well, one thing that I did want to just outline that I normally should do at the beginning, which is me. So my name is Nina, and I am the Regional Head of Veterinary Studies for the College of Animal Welfare. So I oversee the veterinary nursing provision at all of our sites across the UK, and I'm responsible just for making sure that everything is running smoothly, that it's well resourced, and that ultimately the students' experience is as good as we can provide it. So I'm very fortunate to have a team of lecturers that are all inputting into delivery, which we'll talk about in terms of the college and what we can offer. My background is I'm a vet, so I qualified as a vet this year. It's 20 years ago, and made the transition into education and specifically veterinary. And so our team of lecturers are solely vets and vet nurses that they would be delivering on the course as well. So we're very fortunate in that way. So, key points that I am hoping to cover today is why a career in veterinary nursing. Again, hopefully you know maybe why you want to do it, and what this talk will do today is either kind of reaffirm that or may put you off. But I think at this point it's all about honesty. You've got to make sure that it is the career that you want, and the goal there is that it's something that you can imagine yourself doing for a long time post qualification. We'll look at the entry options, and with that, we'll look at whether that could be the diploma, the degree, the different routes that you can get to get into veterinary nursing. We'll also talk a little bit about the apprenticeship versus our non-employed route. Again, we'll talk about what that means, how you can kind of access both of those and the differences between them. The same as I've just said with the diploma and the degree. And again, you wouldn't be here this evening without us telling you a little bit about the College of Animal Welfare. So why call? What can we offer? And again, hopefully we'll be able to paint a really good picture of the provision that we have across all of our centres. Okay, so first things first, who are we? Who are the College of Animal Welfare? Now, normally we deliver this talk at our centres, and so it's quite nice to see a mix of people that have probably come from relatively within those regions. So we deliver it at our Leeds site, our London site, and our Cambridgeshire site. So it'll be interesting to know, again, whether there is sort of a main centre near you, but worry not if that's not the case, because we do have sort of national sort of spread across the UK, which is something that we'll talk about as well. So you may have heard of us by being near one of our centres, or it may be through socials and things as well that you've come across us. But in terms of our background, then we were funded by an animal welfare charity. And again, some of you, if you're Cambridgeshire or near London, it was Wood Green Animal Charity that we first started in. So it was started way back in 1989, and we branched off them after a while, and the college was set up as an independent, not-for-profit organisation. So we are independent; we're not government funded, and in terms of our not-for-profit status, it means that any of the money that is generated through sort of the courses, provision, anything like that, is put straight back into it. So we will talk today about some of the things that we can offer as a college, and one of those will be sort of the virtual reality headsets, which again has been a huge investment by the college. And one of the ways that we've been able to bring that in is through this sort of not-for-profit status, so that the money is kind of reinvested into the college itself for, I suppose, the student experience. So we are a distance learning school, a work-based learning provider. We offer full-time college courses, and we also offer degree programs. So again, with the veterinary nursing specifically, those would be classed as your full-time college courses. And also because we are affiliated and partnered with Middlesex, the degree program is run specifically from three of our centres as well. Some of our other courses. So again, today you might just be kind of getting a feel for veterinary nursing, and if that's the case, then that's great. But you might be want to look at some other courses as well, and that's where the distance learning school or the work-based learning options come in. So they're not necessarily related to veterinary. However, like sort of animal care, grooming, countryside and environment, those are all courses that we offer that could be done fully via sort of distance learning, or done as a sort of a work-based learning provider where you're working in sort of a kennel or cattery and you can undertake the course kind of in alignment with us there. There are education centres throughout the UK. So I've mentioned the big sites that we have. However, again, we'll come on a bit later just to where we are spread across the UK. But basically, regardless of where you are this evening, you will be able to do the course, and the travel to a centre, if you are kind of remote from any of the three ones that I've done, would be quite minimal. So that is something just to bear in mind as well. So geography is not an issue. Where you're located should not be a barrier. Okay, so in terms of the veterinary nursing course, then fingers crossed it is something that you dream of being, and that you're all here this evening because actually you're thinking this is what I want to do. And I said at the beginning that my hope is to make sure that you know exactly what you're getting yourself in for, basically. It's not an easy job, and I'm not going to paint the picture of it all being just cuddling puppies, which is what a lot of people might think that you are in it for. There are some tough times within the course as well. So I think just to kind of again reaffirm why you might want a career in veterinary nursing. So it is very much a professional career working with animals. So I think the biggest thing that we get from anybody that comes to open evenings or when we interview for the course is that, well, I love animals. I really want to work with animals. I want that to be my job. And I think that one of the key things to take from that as well, quite often, what is said at interview. Although since I've started saying this at open evenings, it isn't said as much. So I think my message is getting across is that people will always say, I much prefer to work with animals than to work with humans. So again, we can all relate, I think, to that. However, one thing you do need to be aware of is that every animal that comes through the door has a person attached to it. Your communication is going to be with the person. Even when that animal is removed from their owner or removed from the carer, you're going to be through the back. You're going to be working with the receptionist. You're going to be working with the grumpy vet. So there are people surrounding this role all the time. You're not going to have time where it is like just you and the animal. That is going to be sort of a small element of it. The animals will be there. However, the people skills and the working with people is a big part of it. So that's something just to be aware of as well. And I think that there's a lot of pressure in terms of communication skills because you're dealing with people frontline. You're on reception or you're in a sort of a consultation with an owner, and they could, it's a very emotive situation at times. So they could be angry, they could be upset, and you're going to have to deal with that as well. So the working with people, I'm afraid, is a big part of it. So you're going to have to accept that, and just work out if that definitely is still something that you want to do. Obviously, there is the key to improving animal welfare. People want to get in it because they want to care for the animals, and depending on where they want their career to go, it may be that they want to work in charities, where actually the sort of the improvement of animal welfare and animal treatment has no boundaries in terms of costs. Um, it is a very highly regarded career, both inside and outside of the provision. And I think that that's important to say as well. And no doubt those of you that are interested in going into this route, if you've said it to someone and they've said, oh, the usual question, what do you want to be when you grow up? Um, I think that when you say, oh, I really want to be a veterinary nurse, people will be like, wow, what a really good role to get into. So, there is a really good regard, I think, for it within sort of the general public, but also I think within the team. And that's one of the interesting things that I've had moving into sort of veterinary nursing education is that I suppose the respect that I have for vet nurses has escalated massively. And I respected them a lot in practice because they were my eyes, my ears, my hands. A veterinary nurse, well, a vet without a veterinary nurse is nothing. They look out for us, and they're the ones that are supporting us and again keeping us right most of the time. But then when I came into education and realized just the level that they're having to work at and to learn, I think that, as I say, the respect and the regard for veterinary nurses within the profession as well, from the vets, from the receptionists, from everybody that works with them is high. Depending on what route you do, so we will talk today about the diploma route, and that is a level three. So it's in theory, it states that it's the same as sort of an A-level equivalent, although we all believe that it is probably being sort of delivered and assessed at a slightly higher level than that. It may be that you have a dream of having a degree, and you're like, oh well, I really want to get to go to university and to get a degree. You can do that straight away. We'll talk about the stepping on to the degree program. However, if for this point you're like, I just want to be a veterinary nurse, I want to get there quickly, the diploma is the quickest route. But it doesn't mean that you're signing off ever getting a degree. So we will talk about the fact that whatever route you start on, if it is the diploma, you can still top up to a degree later on. And again, when I do this talk at the centres as well, I quite often pick members of my team that actually a degree didn't exist, say 20 years ago. The degree course is relatively newish in terms of sort of the timescales of the veterinary nursing sort of profession. And there's lots in my team that did it that way. They did the diploma or the equivalent, and they topped up later, and then they topped up to something else again because they're now sort of qualified teachers. They might have done a master's. And I still have people in the team now that have done sort of the diploma route and are topping up to the degree as part of their sort of their teacher training as well. So there is sort of progression opportunities with the academic side as well. The career opportunities we will talk about, there are wide and varied. Again, when I even look at the diverse team that I have delivering on the program, I have nurses that have worked out in South Africa. I have nurses that have worked in referral practices, charities. Um, they are obviously now all working in academia, and they might have worked as reps for drug companies as well. So we will talk about the fact that you can go out and do lots with the qualification. The idea that we all have of a vet nurse in a general practice is great. Quite a lot of them do that, but there's more out there as well. There is variety, obviously, within the role. No day is the same. And I did today do a screenshot of kind of what the job market is looking like as well. So we will come on to that. And, as I said earlier, having had people that have been in the team and gone out to South Africa or used their one of the lecturers that used to work with us is now currently working out in New Zealand. So it can take you lots of places. So it is a very good qualification to have. Okay, so what do veterinary nurses do? Again, some of you may have had the luxury, the benefit of being in practice and being able to do either work experience, or it might be that you're working in a practice at the minute as a kennel assistant or a receptionist. You will have a fair idea, but quite often we have students or potential students that the door is very much closed in lots of practices to work experience, and people are really struggling to get that work experience. So this evening is a little bit of telling you, well, what goes on behind those doors, and what is the role all about. And as I said earlier, it's wide and varied. No 2 days are the same, and I think that it's something that yeah, basically we need to be aware of is that that variety might be what gets you interested, and then and that you don't know what you're going to be facing each day. To some, that might cause anxiety. But basically, you're going to be dealing with whatever animals come through the door that day. So you might be advising the owner on pet welfare. You might be talking to them. You might be doing a weight check. So you might weigh an animal one day, realize it's overweight, talk to the owners about what they're feeding it, what their exercise regime is, what they can do about that. Book them in again for repeat checks, set them some targets. You could be through the back nursing sick animals and administering medication. So again, behind the scenes in a vet practice, you've often got your consult rooms at the front, but through the back, as we always call it, is where you might have a prep room and you might have the operating rooms, but you'll also have the kennel area where the animals that are either getting operated on that day or ones that are just too sick to go home will be. And each of those will be assigned a vet nurse who will be there to support them. They might be cleaning them, they might be giving them physiotherapy, they might be taking them out and giving them some sort of exercise. They might be have to feed them, they'll be having to give them medication. So that hands-on with patients is there. So when I said earlier that yes, there's a lot of time with the owners and with people, yes, you are going to have those cuddles with the animals as well. Um, every animal that undergoes surgery, the vet will most likely be doing the surgery. But I said earlier that the vet nurse for me was my eyes, my ears, my hands. They were everything that I couldn't be doing, especially if I was doing surgery. So when the vet is kind of focused on the surgery that they're doing, it will be the nurse quite often that is the one that is monitoring that anesthetized patient. So they're checking on its heart rate, they're checking on its blood pressure, they're checking all the stats on the animal to make sure that it is kind of remaining stable. And they're reporting that back to the vet. They're telling them, if I'm maybe, I don't know, tugging too hard on it on a part within the operation and the animal's heart rate is going up, the vet nurse needs to report that to me. I then need to decide what I'm going to do. Do I need to increase its pain relief? Do I need to kind of put it on a higher dose of anesthetic? So it is a very important role, but there are high stakes as well. I think that with the anesthesia as well, there's a lot going on with that, which then reiterates the importance of the training that the vet nurses go through. They need to understand about how the lungs work, how drugs work, what all the options are for anesthetizing a patient. What equipment are you going to need for that as well? So, yeah, there's lots involved in that bit. Nurse clinics, we've spoken a little bit about there. When we talked about sort of the diet and the weight ones, it could be that the owners have come in for some worming advice or grooming. It can even be even more complex than that, where you have an animal that has diabetes and you're having to talk to the owner about administering the insulin, about weighing the food, about keeping a diary. There'll be lots paperwork. Paperwork comes with most jobs, and there will be that aspect as well. You're going to have to complete paperwork when you are dealing with the owners, when you are doing that anesthetic, when you've given the medication, you're going to have to be writing that up. And when you're monitoring that patient, while giving it the medication, you might need to check, well, how, does it look at it's in pain? Has it lost any weight since yesterday? So there's lots of kind of checks and paperwork. Also, things like insurance these days will require a lot of sort of input there as well. There will be x-rays that vet nurses are taking, and I can assure you they are far more competent than vets. I definitely talk for myself in that the nurses were always the ones that were doing the x-rays in practice. And also they're supporting with diagnostic tests. So with that, I'm talking about like blood samples. They might be doing some helping with like biopsies. We might have taken a sample out of a tumor and we've put that down the microscope for the nurse to kind of focus in on for the vet to look at. So lots and lots of busy stuff going on. And even with those animals that are in for surgery, they're going to need scrubbed up. They're going to need clipped, so that they're bald for the for the surgery that's going to be going on. So there will be no 2 days that are the same. And I think that, as I say, the role is so wide and varied, which was, from my point of view, people used to always say, well, why do you want to be a vet? Why do you not want to be a doctor? And I used to always think about, well, I wanted the variety. So to me, I always thought that with doctors, you had to then go into, you had to decide what you wanted to specialize on. It could be that you wanted to be a doctor that specializes in, I don't know, the heart or children or eyes. And that's what you're going to see. That's where your focus area is, which is great because they become so competent in those areas. They are the experts in their fields. But I wanted a bit of everything. I wanted to see eyes and kittens and all sorts of animals, and to be helping with the x-rays and to be stitching up a dog that's cut its paw. Um, I think that the variety within veterinary is a big appeal for most people, is that you don't know what to expect and you're going to be using so many different skills every day. So this, we've just had Veterinary Nursing Awareness Month, actually. It was last month. And this was one that I saw many years ago for Veterinary Nursing Awareness Month, which probably was on socials. But it caught me as a really good kind of overview of what a veterinary nurse is doing, or even just a sort of a small aspect. So a veterinary nurse is also an anaesthetist, a surgical assistant, a fracture nurse, a phlebotomist, a lab technician, a radiographer, infection control officer, paramedic, administrator, counselor, nutritionist, teacher, first aider, cuddle buddy, and much, much more. No matter what they say, they do take their work home with them and are always thinking of the patient's care. Thank goodness for veterinary nurses. And I will second that again. That is also one of the things you need to consider as well. It's not a job that you just go home and you don't need to think about it. You will worry about the patient. If it's a patient that's been in and it was really poorly when you left, when you clocked off at, I don't know, 7 o'clock, you're going to worry about it overnight. You might even be texting the nurse to take over, be like, oh, how are they doing? Because, if you did just feel okay about leaving it and not questioning it, you then question, well, is this a profession for you? So, the taking your work home with you, the worrying about it will probably be there as well. In terms of taking your work home with you, you will probably also end up with a collection of, kittens that have lost a leg or a dog that has only one eye. That is something that vet nurses are terrible for. When they see a little case of an animal that needs a new home, they do often end up taking those ones if they can back with them too. So they take them both in mind and sometimes in body. So I said earlier about career options, and it is something to think about. I'm saying similar to one of my daughters at the minute in terms of like, what do you want to do with your life? It's like, what's the best way to think about getting out of a maze? You start at the end and you work your way backwards. So sometimes it's having an idea of what it is you actually want to do. So the veterinary nursing is great. You have a rough idea that that's the kind of the end goal, but actually it's bigger than that. It's thinking about, well, what do you want to do with that qualification? And we ask our students this all the time. We ask them when we interview them, we ask them when they first start on the program, and we have reviews with them every term. And we always say, like, what's your 5-year plan? Or what is it you want to do when you qualify? And there is the general, I just want to be in first opinion practice, small animals, and gain my experience there. It might be that even you're gaining your experience there is, I want to be there for a bit, then I want to be head nurse. And so, you want to take on more of a sort of a leadership role, which I think is, something to consider there as well. Some students start in a referral place, and some want to progress into that as well. And the referral one, if you're not aware of how that works, is that basically your first opinion is like the vet practices that you've probably taken your own pets to, or that you've seen on the high street and that you've passed. Those are the ones that are treating, whatever has come in that day and your general kind of like your GP practice, basically. If the case is too complex and the practice feel that they don't have the facilities, they don't have the training, they're not able to do it, then they will refer you on to a specialist hospital. And again, depending on your geographical region, there will be one usually within sort of an hour or so of where you are. And it will be one that specializes maybe in something to do with orthopedics. So your dog has had a really nasty fracture. The vet is like, I can't fix it. They send you off to get it done. It might be that I don't know, like your animal's had a really difficult sort of brain injury or nervous problem and they go to neurology. It might be that they have a horrendous skin condition that the vet can't get on top of. So these ones are all sent to specialist hospitals, and in those specialist hospitals, you have the specialist vet. So this is where the kind of I suppose what the medics do fits in with veterinary practice is that you will have vets and vet nurses that can specialize in certain areas. So again, quite often if I'm doing this talk at, say, our Cambridgeshire centre, I have one of the vet nursing lecturers there, and she started in a referral hospital and worked there, and her specialist area was neurology, and so she was seeing all the cases that had either spinal problems, brain issues, something to do with their nerves, and that's what she was seeing most of the time, and she was able to give them sort of the amazing care because she was able to focus in on that particular area. Also, they didn't have that many patients. So, within a veterinary practice, a small animal one, you could be seeing, I don't know, a patient every 10 minutes, and you might have 4 or 5 vets that are seeing a patient every 10 minutes. So, if you're through the back and helping and supporting them, that's a lot. With the referral, you might only have a ward with maybe 5 patients in it, depending on the size of it. So the care that you're able to give them or the one-to-one interaction is going to be much higher. You can also branch into um, different areas. So it may be that while small animal is the most popular, there are people that are quite interested in sort of equine or horses. And when I say mixed, what I mean by that mostly is like you might add on farm animals. So, it might be that you're going out in the car with the vet and you're going to go and visit the farms, you're going to go and see the cows, the goats, the sheep, the pigs. So there can be a really, really good mix. Charity work, so the likes of the Blue Cross, Dogs Trust, PDSA, RSPCA, they all employ veterinary nurses. They usually, well, they quite often employ students as well. So people are able to do both the training there, or it might be something that you want to move into. So again, sometimes in practice, people feel they get a lot of tension about sort of the role that finances play sometimes within veterinary practice, in that you might have a patient that isn't insured and the owners aren't able to afford the treatment, and that can really obviously it affects the owners, but as a practice, you want to be doing things on it, and you're going to be restricted on what you can do. So sometimes you get vets and vet nurses that are like, I don't want that to be a barrier. I want to go and work in charity where whoever comes through the door can get whatever we can offer them. And again, that's something that people can move into. Might want to choose that's the career pathway you want to go into. It may be that you wanted to go into teaching. It was quite interesting today because one of the lecturers that I was working with, she found the plan that she wrote when she first started college, which I think was about 15 years ago, maybe. The interesting thing is that I taught her. So we were looking at the names on the review, and she'd written on there that because as I was saying, we always ask about what your career goals are, and she knew even from that point that she wanted to finish her diploma, do a top-up degree, and go in to be a lecturer. And it was lovely to see because there she is in front of me, lecturing and leading on some of our programs, which is great. Industry is looking at things like the pharmaceutical industry or some of the pet food companies. They employ vet nurses specifically as well. And again, academia, education. It might be that the education isn't specifically veterinary nursing. Quite often there's public education or there's education within some of the industry roles as well. It might be that you're educating people within practices on new drugs or new diets. So yeah. it's there's a lot of options. So looking at it in terms of again, just a realistic view, then salary wise, there is a sort of a regional variation, but the vast majority of nurses are starting on around sort of 25 to 30 now. Um, it does go up, and there are different areas and different practices that have kind of capped theirs as well, or they've put kind of a low bar on it. So recently there was one of the big groups that decided that they were going to pay all of their registered vet nurses 30,000, which then meant all the other ones were like, well, we have to do the same as well, otherwise no one's going to work for us. So that helped bring it up a little bit. And there are some referral places that pay, I think, 40 as their standard. And it can trickle up depending on the area that you're in, or where you want to work. So, for example, things like emergency and critical care, where you're working unsociable hours, they call it. It might be that you're working nights for a week and then you get a week off. Often those have higher rates of pay as well, just due to the kind of social inconvenience, shall we call it. Um, so that is something to think about as well. Quite often, if I'm talking to people that are just finishing school, sometimes they're not even thinking about salary. They're like, I just want the job. But we do get, and it could be one of the questions that comes up later, we do get a lot of people that are mature students that have, they might want to quit their job. They might have already done a degree and they just want this as a change. And we get that a lot. We have people up to their 60s and beyond that have chosen to do the course. They might have commitments where they need to make sure that it's going to work financially as well. So I think this is an important one too, is just to be realistic on this is what you're going to get paid. And yes, it might trickle a bit higher, but there is likely going to be a little bit of a ceiling effect on that. In terms of jobs, there is still a high demand from employers. The demand is for the qualified vet nurses. If you're sitting waiting to try and find that apprenticeship, that we are noticing a big decline in practices taking on students and that specific role. However, the qualified vet nurses, there's a lot of jobs that are still out there, and so that's something to consider as well. When I talk about our degree program, we'll look at the fact that I think pretty much every single student that qualifies from the degree has a job, either right at the end of it or they've known where they're going to be going within that last year. So it tends to have at least, well, I would say about 100% moving into a job, which is important to think about as well. So again, if there are any parents in here, then that's something to know is that when you've done the course, regardless if that's diploma or degree, the job opportunity is pretty much there. The next slide was one that I screenshotted today just to give you a little bit of an idea on how many jobs are out there. So it also gives you an idea just of the different sectors that you can work in. So when you're searching for it, you can look at, well, do you want to be just a veterinary nurse? Do you want to be a head nurse? Is it that you're wanting more of a management role? You want to take on some sort of like practice management? Do you want to work in equine? Do you want to work in charity? Do you want to work in emergency and critical care? With exotics, you're there talking about ferrets, rabbits, guinea pigs, snakes. Do you want to work in a hospital or a practice? So actually, this screenshot I think works quite well at summarizing most of what we've spoken about already. Also, it gives you an idea on just saying, yep, that salary that I mentioned is pretty much what things are looking like. And the fact that there are lots of jobs out there. So this was just today that I've done this one. And so, you're looking at there's 530 jobs. And some of those might have been out for a while where people are still trying to recruit someone. So the competition, it's not like a graduate scheme where it might be that there's 500 of you going for one job. Usually, yeah, there's very good success rate of interviews, and mostly it's just about kind of from the person that's going for the role, them making sure that they want the job more than the other way around. I always tell my students that. Okay, this is a slide that I think firms up a lot of what people often come to the open evenings to try and get an understanding of, because they're like, okay, I've seen that there's loads of options. What option is best for me? What are the differences between them? What does that mean in terms of career choices? So I've done it on what we as the College of Animal Welfare offer. You will see that when you look out, there are other ones like foundation degrees and things like this, but pretty much these are the two routes that you can take to become a veterinary nurse. You can either do the level three diploma or you can do the degree. So with the level three diploma, then, well, with both, what I will start by saying is that both of them, you will be a registered veterinary nurse. You will have RVN as your post nominals, and you can apply for the same jobs, and there will pretty much not be any difference in salary. So when you are qualified at the end of it, no one really asks you, are you a degree qualified nurse or are you a diploma? Because you register with the Royal College of Veterinary Surgeons. That's all that matters is that you're a registered veterinary nurse, you've been trained to do the job. The only way that it starts creeping in and making a bit of a difference is things like working in education. So, from my point of view, I have lecturers, I have teaching people that are on the degree. I need them to have a degree. There might be some within maybe like the pharmaceutical industry, and they might specifically say, okay, actually, this is a scientific study or a research post. We want someone that has a degree. When you look up the site, so if the screenshot that I just did earlier, none of those specified that they wanted a degree or a diploma nurse. They just want a vet nurse. So that's something that is important as well, because again, we do get a lot of people that already have a degree, whether that's, we've had people that have got photography degrees, dance degrees, or something more relevant like animal science or zoology. Um, if you didn't want to go through the whole degree program again, the diploma is your quickest route and will get you there as well. So with the diploma, you can go on to that in two ways. You can either be employed by a veterinary practice, and you will do that through the apprenticeship. This sounds amazing. Everybody wants it. However, it is turning into a little bit like gold dust. So in order for that to happen, you need to be applying for jobs in a vet practice that are offering this. So, you might type in student vet nurse, apprenticeship, into sort of a search engine and see what is out there. There are jobs out there, and if you look at our website on the College of Animal Welfare, we have a jobs board, and we, last I looked, still had jobs that were there for student vet nurses to start their training and practices. So I'm painting like a gloomy picture, but the opportunities are out there, and the fact that we have lots, hundreds probably, of students that are employed by a veterinary practice and doing the apprenticeship means that opportunity is out there. So it's to know that. So if you do the employed route, the employers will pay you the salary, and there will be an agreement between the employers and the government, and your course fees will be paid as well. So you will be being paid, your course fees will be being paid. All you need to do is to rock up to college and pass your exams, and you are done. Um, what we found was that a lot of students were, or potential students were wanting to do the program, and year after year was going by and they just couldn't find a position. They were like, this just isn't happening. I really want it. I don't necessarily want to do the degree. I want to be a veterinary nurse. And so we have opened up an opportunity which is a non-employed route. So basically we go, okay, fine, come and sit in the same class and do the same course as these students. The only thing is you will not be paid. So we find you a veterinary nursing practice. So we find you a place where it is registered with the Royal College. You will get your training hours, you will have a mentor assigned to you, and you'll be able to undertake everything that you need to do. But you will not be paid, and the course fees will need to be paid either through loan or however you want that arrangement to be, in order for you to be on that program. So they sit in the same class, they're taught the same thing. One is slightly longer because obviously with the employed route, you are doing the job at the same time as doing the course. So basically you are going into work Monday, Tuesday, Wednesday, Thursday, and it might be that Friday is your college day and you come in. So you're able to do both aspects together. With the non-employed route, then basically what you need to do is you're coming into college one day a week. You have a couple of days where you're able to do the other college work, and we then find you a placement for 6 months within like after your first year, and then at the end of your second year, we find you a placement, usually the same one, for another 6 months. That placement, as I say, is found by us. We have a whole team who will ask where you live, where you want to go, do you drive, kind of what kind of practice do you maybe want to be in? A busy one, a small one, a hospital, referral? Like we try our best to make sure that we can kind of facilitate as much as we can, and we will find that placement for you. So that is kind of like a guarantee with the course as well. We start as soon as you start on the program. It gives us a year to find that placement, and so far that's quite successful. So the way that these are running currently, are that they are running 4 times a year. So we have an intake, seems like I blink my eyes and there's another intake. So we have one in January, one in April, one in July, and one in October. So there is always an opportunity coming up. Generally, our our busiest one is always October because it falls when people have just had exam results, and that's kind of the usual time to be starting on sort of university and college courses. However, the other ones we find are quite busy and building up as well. With the diploma, you have the option of either face-to-face, which is old school, coming into a centre. So every week when you do your training, you will go into either the Leeds Centre, the Huntingdon Centre, which is Cambridgeshire, or our North London Centre. And you will be taught in person by a lecturer there. And that will be your 1 day a week that you'll be going in. So both options, so both whether you're employed or non-employed, you have that option of going in. We found since COVID that that is becoming more and more unpopular. So about 25%, I would say, of our students are continuing face to face. 75% have picked to go virtual. They would much prefer, in terms of environmental and financial, to be at home and to have the lesson delivered online, similar to what we're doing this evening. And those lessons will start at the same time. They'll be delivered by the same team. So the people that I have in the classroom also deliver online, and it will be the same, pretty much the same resources. So there's no difference in terms of I suppose the quality that you're getting. You're getting sort of the good quality lecture. You're getting the same material, and it's the same times and the same days. Um, One thing that I did want to say with that one as well, it came to me and I've just forgotten. It was like a very important point that I wanted to make about the diploma one, face to face, January, employed, non-employed. It will come to me probably when I'm talking about the degree one. But it may be ones that we have questions on a bit later. Oh, that was it. So it was about the days. So one of the reasons why we've put the 6 month placement as opposed to a year is to allow people that have sort of jobs along with it as well that are able to make that a little bit more workable. So again, what we were finding was that people were able to do the first year because they only have to come into college either virtually or face to face 1 day. So we stipulate the day that is the actually someone is talking to you live on that day. Just say that's a Thursday. If you were doing the non-employed route, we have another 2 days of learning that we need to give you, obviously to kind of bring you up to speed with the course, the fact that you're not in practice and you don't have that experience. What we don't say is when you have to do those hours. So for a lot of my students, sometimes they might be doing them in the evening, some of them might be doing them at the weekend, and some of them might just set days aside. They might just say, actually, I'm going to go into college on a Thursday, but my other 2 days are Mondays and Tuesdays. Um, but we found that the majority of people, because they're having to pay for the course themselves, they're not getting paid to do, obviously, the veterinary nursing. They keep whatever job it is that they have, or they find a job. I'm thinking about like my students that I are sort of a tutor for. Some of them work in a care home, some of them work in pet shops, some of them work in retail. So they're able to keep those jobs going at the same time as well, which is something just to think about and go, okay, maybe that could be manageable. With the degree course, then it is a 4 year program, and there is the option of students that don't meet the entry requirements straight away of them doing the a foundation year. So that basically just gives them the grounding on I suppose the maths, the English, the science. Because this is a degree and it's run through UCAS and through Middlesex University, there is only one intake, which is September each year, and that is only delivered face to face. So you would need to be at Middlesex campus, at our Huntingdon in Cambridgeshire campus, or at Leeds in order to do this one. We will go into these in a bit more detail as well. So training as a veterinary nurse, again, these are the main criteria which we can talk about is that you have to be at least 16. The majority of students are probably at least 18, I would say. The GCSEs, you're looking at the equivalent of sort of 9 to 4 for those ones, and that needs to be English, maths, and a science subject, or a kind of equivalent. So it might be that you've done functional skills, or you might have done in terms of your science, it might be animal management diploma or something like that. And work experience we will talk about as well. So again, with the entry requirements, we've spoken about those. You either need to be employed in a veterinary practice or in placement. And again, that practice needs to be an RCVS approved training practice. Work experience, we used to stipulate for both the degree and the diploma that you had to have it because obviously it is ideal, but we are aware that practices, as I said before, are not really keen on work experience students anymore. So we have done that it is preferred, but not a requirement as such. And it's something that we can help you with as well. If we do take you on the program, we might be able to help source work experience that you can do within your course as well. In terms of how you will learn, there is lots and lots of elements. So I will say to students, must feel like they're spinning lots of plates. So they are working on assignments and case studies. They are doing multiple choice exams. In practice, they have to do what's called a nursing progress log, where basically they are building a series of skills, getting assessed on them by their mentor in practice and signing them off. So it could be anything from injecting a patient with a drug to I don't know, brushing an animal's teeth. Lots and lots of skills that need to be built up over the 2 years. And there's also practical skills and practical examinations associated with it too. As part of both the degree and the diploma, we have what's called an SQP, which is a suitably qualified person qualification. And that's basically like a mini pharmacist. It gives the vet nurses the well, basically, they are allowed to give out certain drugs, such as sort of wormers and flea treatment, that sort of some, well, nurses without the qualification wouldn't be able to give out, which is important. This one just gives a little bit of an overview of the difference, I suppose, between the provisions. So it's just to say that face-to-face is you have a person in front of you that is teaching you, you're with your peers, and you're in a classroom and you're able to kind of get that interaction, which for some is still really important to them. So that is an offering that we have, as I say, at our main centres. With the live online, what I was trying to see here is that you still do get a person. So like this evening, there was someone talking to you. They're able to talk to you, to bring you in on mic, to chat to you in the chat section, and they're going to be delivering the PowerPoint to you. They're going to be talking to you and giving you tasks to do. They can put you in breakout rooms for discussion. They can open up whiteboards where you're having to pin things on it. So both are very, very kind of interactive as much as we can be. In terms of the what, again, this is just a snapshot. We're not going to go through all this, but both the small animal, the companion animals, and the equine, there are obviously similarities across both. Is that you're going to be learning about sort of the rules and the regulations of a vet nurse, what they can and can't do. You're going to be learning about the drugs. You're going to be learning about how to do an X-ray, how to set up a drip. So there's lots and lots of, well, there's basically 4 modules that you do in your first year and 4 modules that you do in your second year. And then there's a series of sort of practical skills embedded within that as well. Where will you learn? So this is our kind of geographical spread at the minute. So we are as far up as Edinburgh and as far down as Guernsey. And our main centres where you can do face-to-face are, as I say, Leeds, North London, and that Huntingdon centre. The other ones we classify as satellites. So again, it may be that if you're way down near Bodmin, that is the centre that you want to go to. You wouldn't go there for your day-to-day lessons. You would only have to go in there for the practicals, which come way at the end. So at the end of the 2-year program, there's a block of maybe 5 or so lessons. So your weekly ones, instead of being online, suddenly become practicals. We have to deliver those in specific centres, and all of these ones have been approved for us to deliver our practical skills there. So if you were nowhere near any of them, or it was at least a 2-hour trek to some of them, you are only going to have to go to that centre, as I say, 5 to 10 times. So it's not going to be kind of that massive ongoing drive back and forwards, which hopefully helps a little bit. Course fees, again, it's important just to have an awareness of that, is to go onto our website. I've just done a screenshot on that one, but it does depend on, again, whether you're UK, overseas, but this gives you a little bit of an outline of the fees that you're paying there as well. If you have done the degree before and you've tapped into student finance that way, this course would be funded differently. So it could still be that you get a loan through a different company in order to do it, which is what many of our students do. So there's loans for you. Again, there's areas on our website where we'll be able to give you that kind of guidance on sort of how you could cover that. Or there's the options of pay as you learn, where it may be a monthly direct debit that you can kind of stagger the course on. So there's lots of options for the course fees if it was not the apprenticeship that you were doing. Okay, so with the degree course then, as I say, it's run with Middlesex University. And we were, for 2 years in a row now, have been voted #1 for veterinary nursing within the UK, which is something that we are very proud of. So this was done as part of the National Student Survey. So this was our students that actually gave us this. We haven't been awarded it by, I don't know, like a practice or the university. It as the voice of the students. And so 100% of the students said that the course is intellectually stimulating. They said that the teaching staff make the subject engaging, and also that the lessons are building on things that they've already learned. So overall, the program scored 98% for teaching on the course, 94.5 for learning opportunities, and 91.9 for assessment and feedback. So all what I would say is excellent and very high scores. The RCVS requirements are needed, so the GCSEs are still required as part of this one. But in terms of A levels, then we're looking at CCC, which we would hope includes a science subject, preferably biology. But again, that's something that we can discuss on admissions. We do also accept the National Extended Diploma, which would be merit, merit, merit. Or any of the sort of HE diplomas or access courses. And again, applicants over 21 showing high levels of ability and experience in the veterinary case sector are invited to apply as well. So it is one that you're able to basically look at what the qualifications you have, and then you can do sort of the UCAS check on your points to see if you're eligible for it. So with the foundation degree, then as I say, those are usually for students that haven't met the criteria that they need to with regards to the A levels, or that their BTEC was maybe at a slightly kind of lower level. So maybe you only got merit pass. So again, points for this is usually about 56 to 64. And again, we obviously accept kind of learners over 21 as well. Work experience, again, is preferred but not needed. And quite often with this course as well, I don't think we close off. There might only be a small window where we close off the course. But because we have the benefit of having the 3 campuses and the foundation year, quite often we're able to continue applications. So if it was something that you were thinking about, but you think, oh, well, I've already missed it for this year, by all means not. Some of the courses may be open and clearing as well, which would be positive if you're interested in that. So the key points with the degree is that it's a 4, or it would be 5 if you did the foundation year program, with 56 weeks of placement included. So again, we will find your placement. We have a whole team that is our stress to take on. Again, quite often a lot of the other programs and other degrees ask students to find their own. And I think that's a very tough ask. We offer, as I say, at Leeds, Huntingdon, and Hendon at Middlesex, and it's all made through the UCAS website. So again, going back to the diploma, that's all made through ours, as in the College of Animal Welfare website, whereas these ones for Middlesex has to go through UCAS. And as I said earlier, the work experience is preferred, but not necessarily needed. This gives you very much an overview of the course and how it works. I am not going to talk through all of it. What to see is that it is a busy time and it's integrated with time at college, again, these are the ones you are coming face to face. So you're coming into the centre. Usually that is a minimum of 3 up to 4 days, sometimes 5 a week. So it is quite different, I think, to some of the other university courses where, you might have a lot of online work or seminars. The lessons are generally running sort of at least sort of 9, 10 o'clock until 4. So they're long days and they have to be in because basically with the professional regulation, we need to sign off that the students have attended all of these ones as well. I mentioned earlier as well that if you have done the diploma, it might be straight after, or it might be further down that you decide that after 10 years of being qualified with a diploma, you're like, I want to do I want a degree. There is the opportunity for a top-up degree as well. So you can top your diploma up into that BSc honours. And it can either be done in sort of 2 years or 4 years, done alongside your work. And again, that would top your diploma up to a degree if it was still something that was on your bucket list of things to do. Career progression, we mentioned earlier, this is just a repeat, which is basically saying that everything that we've spoken about in terms of the career opportunities are things that you can go out and do. So you're able to progress up in leadership and management and become a head nurse. You might go into specialist areas like physiotherapy. You might go into teaching. So it's never a role where you have to sit back and go, well, this is what I'm resigned to do forever. You can always use that qualification for other things. That is most of the veterinary nursing. I have included veterinary care assistants, and for those of you that are thought, oh, I came here for veterinary nursing, please don't switch off now because for some of you it may be relevant because you're thinking, ooh, I don't have my GCSEs, what do I do? Or for some of you, you might be thinking, okay, actually, that sounds good, but it sounds pretty intense. I might want more of a kind of a stepping stone into it. So the veterinary care assistant course is one that is much more kind of a short, snappier version of the veterinary nursing one, but it leads to a job role in itself. So the career options, the ones that are kind of paying attention, will realize this is pretty much the same as a veterinary nurse one. So everywhere you will find a vet, everywhere that you find a veterinary nurse, you will find a veterinary care assistant. Sometimes they're called patient care assistants, sometimes they're called animal nursing assistants. So that we cannot help, is that when you start Googling it, you'll find they've all got different names, but quite often there are more veterinary care assistants or patient care assistants in a practice than there are veterinary nurses because they are very hands-on. Before, when I was saying about all the interaction with the owners and less with the animals, actually the veterinary care assistants probably have more with the owners. So it's done through the diploma or an apprenticeship again. There are no entry requirements. So it's a level 2 course. And we say that it's roll on, roll off. I always get in trouble from admissions because I always just say, you could phone up tomorrow and be on the course. I mean, you can phone up tomorrow and we can get you started on the course as soon as we can. However, obviously, there are delays with things like getting you sort of registered on the program and things as well. So it is one where you can start at any point. You need to be either working or volunteer in a veterinary practice. Quite often, veterinary practices are a little bit more keen to have a veterinary care assistant than they are veterinary nursing because there's less work, I suppose, to do. The mentor doesn't have to do as much as they would do for a veterinary nurse. Also, they do not have to be registered the practices with the Royal College, so it makes it that you've kind of got access to more. It can be done within 6 months. That's if you're kind of full blast and doing it. You have to have a mentor in practice and it needs to be done from the age 16 onwards. The good thing about this one is that it can be done alongside adding in sort of functional skills, maths and English. We can put that in and we provide the training for that as part of this qualification. So if you do the veterinary care assistant course, that counts as your science and the maths and the English that we embed into it obviously then gives you the maths and English that you need as part of the entry requirements. So if you're finding that you don't have the entry requirements, this gives you it, which is why I always include it, is that actually don't worry about having to go back to school or start night classes in GCSE English. Actually, do the veterinary care assistant course. It gives you the requirements that you need to get onto the program. Okay, so a little bit of a summary there about the support that we have at the College of Animal Welfare. So I've kind of sold them quite well in terms of the team that we have. So the veterinary nursing lecturers are only going to be vets and vet nurses. They will be lecturing and they will have specialist areas that they will be kind of tapping into. They also have to do sort of days back in practice, so they're still quite current, and lots of them have extra qualifications as well. In practice, you'll have what's called a clinical supervisor. So when we send you out into placement or if you're employed in a practice, there will be someone there that is your go-to, and they're going to be telling you how to scrub up a patient for surgery, how to monitor the anesthetic. So that is basically we provide the training on for them as well to say this is what you need to do with your student, this is how to do coaching. Um, we will send out a placement officer as well. So when you are out on placement, we don't just wave you off and say, bye, see you in 6 months. We come out and visit you and we come and we sit with you and we ask how things are going and we check in on you at least twice whilst you're on that placement. And in between as well, we're emailing you, we're doing, again, like video calls as well. You'll have people that mark your assignment, and quite often those are the people that are in front of you week on week as well. So actually, if you're doing your assignment and you're struggling with it, you've got a go-to person. Um, we have a whole team of learning support advisors, and they are there to support lecturers, to support the students, but also mostly to support the students. It may be that you come with diverse needs, and maybe that you find that when you're on the program, you think, "Oh God, I've not studied for a while, but actually, I'm beginning to struggle with this, this, and this." They can help with things like dyslexia screening. They can help with time management. They can help with check-ins on students if you're going through a tough time and it's a well-being check. So um, we are very accommodating for students and recognize that every student is different, and we want to make sure that we can kind of accommodate for that within our teaching. Every student is assigned an academic advisor, which is their go-to person for any sort of questions that they have, be that academic, that they've struggled with something they've learned that week, or they're having a tough time at home, things are going on, and they need someone to talk to help them kind of navigate that. Um, and when it comes to the practicals, when you're out either in the centre or one of those satellite centres, there will be either a vet or a vet nurse there again. They'll be the ones that will be teaching you those key skills. Mentioned about the VR headsets, and we can put the link for that in. And this I will leave up before I just go on and go through the questions, just so you've got contact details there as well, which is our main kind of administration line. That if there's any follow-up questions that we haven't covered today, or if you need to nip off now before I go on to the Q&A, please do follow us on socials where we put all sorts of updates on, and yeah, send us an email, and you can say that you were here this evening, and they'll be able to ping it across to me. So I am just going to have a quick look in the Q&A and see if I can have a look through that one. I think I've covered most of them. I'm just going to read through them as we go. So what does mixed include? Is it more farm animals, exotic? So yeah, mixed tends to be related to farm animals. So when they say mixed practice, they mean you're going to get mixed with small animals, and it will be your farm animals as well. And yeah, exotics, if it was an exotic specialist, that's where it is, we call it small furries and reptiles, basically. So it's your rabbits, your guinea pigs, your hamsters, your snakes, your tortoises. So can you still do a specialized sector after you do the level 3 qualification? Yes, the level 3 qualification makes you a registered veterinary nurse. That gives you the passport to go anywhere and do anything with it. Your specialism comes from training and gaining confidence and competence in those areas. So, yes, you can do top-up qualifications. So it could be that you want to do physiotherapy, which is very much a top-up master's degree one. But if you wanted to work in emergency and critical care, you can work in that as a student and as a registered veterinary nurse, but you can also specialize in that and do a certificate in it because you want to up your own knowledge in that area. Okay. As I have a previous degree, I received. I think I've covered that one. So some of them I'm not going to read out if they're more personalised, but if you've already done a degree and you have had the student loan, I think I've mentioned that you are able to tap into different loan scheme with that one as well. I'm currently not employed by a veterinary clinic. I would like to be in order to apply for the 30 months course. I would only be able to do positions. Oh, such. Okay. Just going to read it out as well. I just want to make sure before I read these ones out as well. So, I am not currently employed by a veterinary clinic. I would like to be in order to apply for the diploma course. As an entry-level candidate, I would only be able to apply for positions at clinics appropriate to that level of experience. Would a role such as a veterinary assistant or veterinary receptionist suffice? If so, and if working at an RCVS listed clinic, are such clinics required today release students for the RoRo study, or is this at their discretion? So basically, I'm just trying to get to grips with that question. If you are starting out fresh, it doesn't, you can apply for any clinic that has a job role going. So if it was that you wanted to become a veterinary nurse, you don't have to have been a veterinary care assistant or a receptionist first. Quite often, I always say to students, that is your step in the door. If you are really struggling to find like a student vet nursing position, but a practice down the road has receptionist or veterinary care assistant, by all means go for it, because actually quite often our students that are employed have come through that route. They have gone in and made it quite clear that, I'd love to be the receptionist, but my dream is to be a vet nurse. The practice will be like, right, come on, let's see how you get on. And maybe after 6 months, maybe after a year, you will be able to go into it. So this also leads me on to our non-employed students, in that we are finding that there are quite a few success stories with even within their first year. Those that have been on placement for that 6 month period, they've been employed within that time. The practice, either that practice or another practice will be like, oh, actually, you've done a year of the program, you've done work experience now, you're working your way through your list of kind of skills and portfolio. We will employ you. So there is the option to switch partway through the program if you wanted to as well. So I hope that that helps as well. So basically, you can apply anywhere you want to go to. You don't have to have experience to apply for the student vet nurse role. It helps, but they you wouldn't. Well, we've had many students that have basically, as I say, started afresh in the student vet nurse role with no experience whatsoever. So if doing the non-employed diploma option, are the 2 times 6 months placement full-time or part-time? They have to be full-time. So you will be doing 5 days a week and probably say like, I don't know, 35, 37 hours a week in that time as well. That's down to the practice and you to kind of come up with that. But we need you to have done a certain number of hours in order for you to gain the experience, but also as part of the registering as a registered veterinary nurse, we need to evidence that you've done over 2,000 hours in practice. So those need to be done at full time. And again, due to the law within the UK, you cannot be unpaid for more than 52 weeks. As soon as you've done 52 weeks worth of voluntary or free or work experience, the law basically changes in that you would need to be paid. And practices, obviously, at that point, don't want to get into that kind of legal battle. So we need to make sure you've done everything within those 52 weeks. So how many hours weekly are you expected to do in the 6 month block? Well, there you go. It would usually be sort of the 37 and a half that you would have to do. Um, Okay, I'm just going to work through some of these ones as well. Is there any literature for independent theoretical study relating to small animal anatomy and physiology? So, what I would recommend in terms of people that are looking for something to do, there is a textbook called the BSAVA, so the British Small Animal Veterinary Association, textbook in veterinary nursing. Think it's the sixth edition. And that would be a very good textbook. That is what our students are recommended, and it gives a really good grounding. It has anatomy and physiology, it has how to give an injection, it has different beddings and things. So that's a really good one that I think will help and give you a good understanding on that one. With the unemployed diploma route, can you do, oh, we've done that one. I'm going to say answered live. I've now worked out how I can tell people that I've answered these ones. Um, Okay, with the unemployed diploma route, can you do hours? Okay, done that one. For the level three diploma, in your entry requirements, you said you have to be employed or have a work placement arranged in practice, but I thought you could apply and the college help us. Yes. So basically that's what it's saying is that from us registering you as a student vet nurse, we have to say either we're finding you a placement or you have to say that you're employed by one. So yes, we will find you the placement for that one. Would a degree be advantageous to enter more specialist areas such as exotic animals or marine life? In terms of the role of an SVN, the diploma would still, if it is the skill set of a veterinary nurse, the diploma would still work for, well, be much the same for the exotics ones. As I say, usually it only would be required for academic or research. What I would say there is similar to what I said at the beginning of looking at the like working your way back from the maze is have a look at some of the jobs that you think that you might be interested in. So look at exotics, like registered veterinary nurse or a marine registered veterinary nurse, and see what they're saying. If they're not specifying on there that they have to have a degree, then which I don't think they would, then again the diploma should be fine. Can you have a mix of face-to-face and online? You can't change, well, you can't chop and change each week. We have had students that have started one and then swapped to the other in both directions. So some have started on the face-to-face, for example, and then realized that actually the M11 is a nightmare in the morning and they'd much prefer just to kind of go online. Likewise, we've had students that are online that are feeling, "Oh, I really want to see real people." And they're like, I might just do the hour and a half journey and get in. So you can't chop and change it each week, but you there is the opportunity to swap it if you felt you wanted to start with one and see how it goes. Could you please elaborate on the loans to learn and how that could be used with the advanced learner loan, please? The best thing to do with that is go on our website. So on our website, there's a finance section, because quite often it will be personal to you. So is to go on to the loans to learn, and well, basically go on to the finance section and the loans. If it's not clear on there, definitely just give us a call. We have a team, and that is their specialist area, and they'll be able to talk through your situation as well with that one. Okay, what types of funding are there for mature students with university degrees already? That's the same one. Go to the same area. So the finance area on the College of Animal Welfare's website will give you that. So again, we have quite a lot of students that already have a degree and have already got that student debt. This is where you can kind of, as I say, the loan comes from a different source, so it's available to tap into. Does what does the application interview process look like for the diploma and how competitive is the intake? So again, with both the diploma and the degree, we interview all of our students, regardless if they are employed, not employed, doing the degree, doing the diploma. The application is, as I say, online for both of them. The interview is virtual. So again, we do it mostly as a Teams call, and it's just finding out about you, finding out that you know what you're getting yourself in for, finding out why you want to be a veterinary nurse, finding out what has led you to realize that that's what you want to do, and just a bit of insight, I suppose, into your background. So it may be that you've not been in academia for a while, or it may be that we talk to you about your A-level choices and how you kind of, what subjects you enjoyed and what subjects you didn't. So they are quite relaxed. It's more us just trying to find out a bit more about you to make sure that we've put you on the right program as well. And in terms of competition, with the diploma one, I'm just trying to think. Usually there's a bit of signposting with both the diploma and the degree. If that we didn't feel that it was right for you at that point, we would signpost you to maybe you want the foundation year, or maybe you would be better off gaining some like doing the veterinary care assistant one first. So we'd say, it is competitive. Not everybody that applies gets it, but we do give feedback and we do give guidance if it was a no. If you were more of a mature learner, then we've had this before where people don't necessarily have their GCSE certificates. I would say is to call up our admissions team and speak to them about that one because they might be able to go through different options where, depending on how long ago you did it, there are things that they can tap into where they're able to help access those. If not, we have had students that have had to do perhaps the veterinary care assistant course, so spend 6 months doing that to kind of reinvigorate their GCSEs again. So that one is probably worth a phone call to us, definitely. What things do we need in preparation for the degree in September, like uniform? That is all sent out in advance. So if you're coming to do the degree, we will send you out a list of things. Generally, it is making sure that you have a device that you can access your online learn, well, your learning on, type up your assignments on. The uniform we give guidance on when you start and when you find your placement, because some placements have their own brands of uniform. So we will give guidance on that one as well. How is information delivered and what note taking is the best, like books, folders, digital notes? All students are very different with this one. So I was teaching, well, taught a lot over the last few weeks, both face to face and in the classroom and online. Online, students often, we give them access to all the material that we're delivering. So for example, if this was tonight, you would have this PowerPoint and you would be able to have it up and make like normally students sit and type notes to it, or sometimes students have it up and they've got a notepad next to them and they're making notes. Sometimes in a lesson, students will bring dictaphones and they'll record you. They're most still are on laptops these days, but there are still people that have their kind of ledgers and paper as well. It's just whatever works for you. Um, there are some bursaries, I think, not through the college, but again, if you go on our finance area of the website, there are some companies and charities that do look at bursaries. And also, again, there are some funds like hardship funds as well that might be worthwhile looking at. But again, it depends on your own circumstances, your background and things as well. So I would say the finance area is the best place for that one. What days does the degree course run in a week, Monday through to Friday? So with the degree, it does change each module. So you're in for 12 weeks, and in that 12 weeks, you will be in the same days for that 12-week block, which could be a Wednesday, a Thursday, and a Friday. So you always come a Wednesday, Thursday, Friday, Wednesday, Thursday, Friday. When you come in again in the next block, so maybe you've gone out onto placement, or maybe it's been the holidays and you come back, those days may change. You might then be in on a Monday, Tuesday, Wednesday. So we publish the timetable well in advance, so you always know, I would hope, with months and months notice of what days you're coming in on. But generally, as I say, it will be a minimum of 3 days a week, quite often four, because sometimes we add on sort of a practical day as well. When you apply, how far of an intake in advance can you choose, or does it have to be the next available intake? Right. Okay. So yeah, basically, if it's now, which is June, um, we are probably closed off potentially for our July intake. Could you apply for October? Yes. Could you apply for January? Probably yes. Sometimes we only release them on our website, maybe sort of 4 to 6 months in advance. But you can get in the system and switch it later on. So you might be that you want to get the interview and everything over and done with and go and apply for October and then contact us closer to the time and say, actually, can I move that to January? So yeah, you're able to do that one. If I decide later on to go from a nurse to a vet, would I be topping up knowledge? You always have to start from scratch. We have had like quite a few nurses that have gone down that route. I would say there are different routes. If ultimately you know you want to be a vet, this probably isn't the route for you. There are access courses, there are diplomas, A level. There are lots of other options to look at. Because it's a very different role, very different course. However, if you're just thinking wider, that would it be something that I can top up to a vet with? No. The basically there might be the potential to start in a second year of a 5-year vet program, but you wouldn't be able to kind of I suppose fast track any faster than that. When is the best time to apply for both employment and college post A level for the level 3? I would say the employment one all the time. Just look all the time because as I say, it is very, very competitive to be employed. Um, don't always just look at the student vet nurse positions. Look at the receptionist, look at the patient care assistants, look at anything in a practice that will get you in that door. Sometimes I always say to the students as well is if you're looking and you keep seeing a registered vet nurse position or a qualified vet nurse position that's been on for months and months and months, no harm in applying. Quite often I say to my students that are on the program, just give it a bash. Sometimes we've had students that have, it might be a local practice to them, and they might just say, look, I've been given a position on the program, which is why I sometimes say to students that actually, even if you're not employed now, maybe apply for the non-employed route. Because then you've got that position given. We might just say to you, right, okay, you've got an offer. You'll start in October. You can then tell practices, I'm already on the course. I've met the criteria. I'm on it. And then I suppose from that point of view, you might be more employable. I'm a registered dental nurse level 3 diploma. I do not have maths English. Would I sit key skills whilst on placement? So you would need to do that before. So from our point of view, we couldn't enroll you on the program without the maths and English. Again, if you look at our website on courses, we offer what's called basic skill, functional skills, which can be done within sort of months. Basically, you would work with a tutor and work through the online material for that one. So as soon as those results were through, you could then apply for the veterinary nursing one. Also, what would work placement be near to your home? Yes. So with the placement team, they start by asking where you live, what's your postcode, and they have a whole map of every practice in the UK, and they will work their way out from that one. So it would be as close to your home as we could make it. A mature student looking for a career change. Are you able to apply for the level diploma with no past experience? Yes. So again, experience is great, but sometimes life experience beats everything because you've got more of an awareness of working in a team and working with people and grumpy clients. So yeah, as I said within the presentation, it's great if you can get veterinary experience, but we realize now that it is such a struggle that we will help find that when you're already on the program. So ahead of you going out for your 6 week placement, 6 week, 6 month placement, we would be able to set you up with some days where you could get that experience as well. Um, will it able to change campus but still the same course? Yes. That happens from time to time. That if people move, then either on the diploma and the degree, um, the course, or even if it's again, if it's on the diploma and you move and you want to go virtual as opposed to being at a centre, that could be done. Our courses are delivered the same time at every centre. So with the degree, the same days and the same sessions are being kind of completed that same week. The same with the diploma is that some days I might have 5 or 6 groups that are being taught across the UK, the same thing. So yeah, that's absolutely fine. Does employed route only cover apprenticeship? Can you find your own work placement that's unpaid but do the hours across the 2 years rather than the 6 months block? No, because that's the rule that I mentioned earlier. We would love that to be the case because that sounds like a win-win, doesn't it? But unfortunately, as I say, with the government, this you cannot work unpaid for more than 52 weeks. And if you wouldn't be able to complete the course and get the hours within 52 weeks because you would automatically be taking out a day a week. We need you to be doing the 52 weeks, but with 5 days a week in order to get the hours. So yeah, unfortunately, that one isn't an option. Um, So if you were living down in Devon and you wanted to do the degree, you would have to come in to one of our centres. We do have one thing I should have said is that with Huntingdon and obviously with Hendon, there is student accommodation. So the Huntingdon one is probably easier because we have houses that we've bought privately that we rent to our students, and literally it's across the road. And with the Huntingdon Centre as well, the class sizes are much smaller. With Hendon, we tend to go up to about 50 students, and with Huntingdon, we tend to be about sort of 20 max. So yeah, you would have to come into a centre for that. However, you could look at options for student accommodation. Okay, I think all of those questions are now answered. I don't know if there was anything else. Um, Thank you to Alison, who has been helping me this evening by answering lots of questions. I'm hoping that all the questions, yeah, have been answered. If there's anything else, I'll just keep an eye on both chats. Um, but yeah, it was been really great to have all your questions come through, and I hope I've answered as many as I can. Let me just have a look again. I've lost it. Let's see. Q&A. Okay, if you completed the diploma but then wanted to top up to the degree, do you still need to meet the A-level requirement? No. Your diploma counts as your A levels. So the only requirement with the top up degree is that you are a registered vet nurse, which automatically you will be from completing the diploma course. So that one is absolutely fine. You don't need to go back, do your A levels again, and then try and top up. Okay. Can't see any more questions in the chat just yet. But yeah, thank you so much again for your time this evening. And if there's any other questions, you've got the email address up there. Thank you and have a good evening.